Hi, everyone. Welcome in. Welcome to our third Overcoming Enmeshment webinar. Today, we are here with Erin Wysong-Warren. She is our Women's Workshop Facilitator, as well as the Clinical Director and Therapist at CCIA in Dallas, Texas. And today, she is going to be going over the partner experience with enmeshment and kind of how to start on this enmeshment journey. If you have any questions, be sure to enter them into the chat and we will be answering them at the end. If you can't stay for the entirety of the chat, don't worry, we will be posting these on the blog, so you can check that out later as well. And I'm going to be turning it over to Erin.
Okay, thank you for that introduction. So I am a therapist in Dallas, and I have been referring enmeshment to Ken Adams since 2014 with great success. And so that's how my relationship with Dr. Adams evolved. And I am now facilitating his workshop for women. I also work with sex addiction and betrayed partners in my private practice. So I think there's probably a couple reasons why you might be here today. Either you suspect that your partner is enmeshed with his mother, or maybe you're an enmeshed man and you're here trying to understand better the experience of your spouse. So for the purpose of this discussion, I'm going to be using mother enmeshed men interchangeably with like husband and then partner or wife. Obviously, this applies to any kind of couple, but just to make it easy, that's the way I'm going to do it. And there are some nuances when you're working with a female who's enmeshed with a spouse, and maybe or enmeshed with a parent. Maybe we'll have time to address that a little bit at the end. So I thought I would get started with just a little bit of an overview of enmeshment. So if there's anybody that's not that familiar with it, they can get that explanation. So generally, enmeshment would be too much closeness or dependency within the family of origin. The family of origin demands just unreasonable loyalty, typically at the expense of the enmeshed adult's partner. And the partner of the enmeshed adult may be seen as a threat to the family system. So, excuse me, my mouth is dry. So, enmeshment is about the parent-child relationship. It starts very early in life, and the child becomes a surrogate spouse in the enmeshed relationship. What happens is, well, enmeshment is a form of neglect, because when a child is growing up and the adult is getting their emotional needs met from the child is not getting his or her emotional needs met from the parent. And so parenting is supposed to be a one-way relationship where the parent is giving unconditional love to the child, and the child is allowed to be a child and is not responsible for the mother or the father's emotions. So that's how enmeshment gets set up in the family of origin. So typically, the enmeshed adult has excessive responsibility for the emotional needs of the parent. The enmeshed adult feels burdened by the responsibility, and at the same time feels powerless to do anything about it. And that powerlessness starts to happen in childhood. And so even though you grow up and you might be in an adult body, your thinking about that doesn't change just because you get bigger and older. So an adult enmeshed child feels feelings of guilt, anger, ambivalence. They are typically unable to identify their own needs or be able to make decisions about things for themselves, because their whole life. Their thinking has been around what do I need to do to please this parent and what the parent's needs are. So they're not really focused or even able to identify what their own needs are. Their primary loyalty is to the parent and not to their spouse. The internal compass regarding decisions is based on obligatory guilt. So it's not based on the freedom for the adult to be himself or to be authentic. Let's talk a little bit about symptoms that maybe you've observed in your partner who you believe is enmeshed with his mom, his or her mom. As I mentioned, difficulty making decisions or commitments, and that might be something as simple as like where to go eat or what movie you're going to go see if you're going out on a date. Just not used to thinking about what they want, but what everybody else wants. Your partner may experience low self-worth, have low self-esteem. They make compromises to try to placate or please everybody around them. And what ends up happening is they end up disappointing everyone, displeasing everyone. They may have no sort of identified purpose with regard to their life. So sort of ambling around. They may have impulse control issues related to food or sex. This is very common. These behaviors around food and sex give the person a sense of control over something because the mother can't control over what they're eating or what their sex life is like. The enmeshed partner may have sexual dysfunction, unable to own his own passion, unable to connect erotically with their partner without feeling guilt. They may not be able to connect to their own sense of masculinity, and they may even feel sexually inadequate. You may observe that they will displace anger at their mom onto the partner. They will perceive their partner as wanting or needing too much from them, even though it might be normal needs of everyday living. And it has very little to do with the needs of the family, but more about the spouse's feelings of entrapment around his mother. So we might be touchy and say things like, don't pressure me, or you're trying to control me, when you have just a reasonable request or need for the family. The enmeshed man may have difficulty with boundaries, so they may have walls for boundaries. So they're unable to connect intimately, emotionally. His mother may be very critical of you. He does what his mother tells him to do without consulting with you, possibly. He might go out of his way to keep you and his mother apart. He might gaslight you if you are trying to convince him to prioritize his relationship with you. He may lie to you about how much time he's actually spending with his mother. So what is the experience of the partner like? The partner feels second to the family of origin. You may feel unsure of your importance. You may be rebuffed if you try to discuss it with your partner. You may be overly burdened with responsibilities of your household or your children. Feel maybe like you're left holding holding the bag. You may feel feelings of resentment toward your partner. After your partner has had a visit or a phone call with his mom, he might be irritable or reactive towards you. even though it has nothing to do with you. He could be critical of you. He could be distant, and that really is about the relationship with mom and not about his relationship with you. You may experience being blamed for problems in the relationship, which is unreasonable because, in any relationship, there are two people involved in the relationship, but that is a defensive reaction of the mother enmeshed man who is unable to deal with the feelings that he has towards his mother. And so you become the object for his projection of his feelings about her. You may feel unsure about your importance to your enmeshed partner. You may feel a significant amount of distance put in between you for no apparent reason. You may begin to feel angry and resentful because of the compromises that you have to make being in this relationship. You might be frustrated by your spouse's inability to make decisions. So I think that's about all of those points. So this workshop today, or this webinar today, is supposed to be about what you can do to help yourself. So one of the things that you can do is to, when you want to talk to your partner about it, avoid confrontation by using a soft startup. Like, I'm concerned about versus you always do XYZ related to your mom. So just being approachable when you have a conversation. Otherwise, it's going to be met with resistance, defensiveness, probably anger. I think that, it's very important to seek counseling, couples counseling, with somebody who is trained in enmeshment issues. I know that Dr. Adams has a list on his website of people that he has trained, or at least with a couples therapist who's willing to learn more about enmeshment. Maybe read Dr. Adams' books, When He's Married to Mom or Silently Seduced. But you really need somebody who can help you navigate this kind of recovery work, because it is kind of specialized in the way you have to deal with it. Another tip, like, you don't want to demonize your partner's family. That will be met with defensiveness. He will be, protective of the family, and might get angry with you. So one thing to really focus on is identifying what your needs and wants are for yourself, and being able to communicate those to your husband or your partner, so that you can express them as needs that you have for yourself or for the relationship, instead of telling him what he needs to do, which again is going to be met with defensiveness. He's going to feel like you're trying to control him, or that you are demanding and wanting too much from him. I suggest that you seek individual counseling for your own betrayal. Both parties in this situation have been betrayed. You're being betrayed by your partner. Your partner has been betrayed by his parent. So both of you on a certain level are experiencing betrayal trauma. So seeking out individual counseling for yourself on how to deal with that. Identifying your self-care needs so that you can get those needs met yourself, whether that is through a therapy group or a support group, maybe a spiritual leader or church group, through friends. Maybe you have good relationships with your own family members, but in this situation, you're not going to get that from your spouse, at least not when you start in this process of working on the relationship, which is a long process and takes a lot of time and a lot of hard work. So you want to make sure that you have those resources available to you. Dr. Adams has a chapter in his book, I believe it's chapter 13, titled "Should I Stay or Should I Go?" That would be a great book to read as a partner to get more understanding about what your options are and just how you manage things in the relationship with the enmeshed partner. You want to avoid monitoring your enmeshed partner's contact with his mother. That will be perceived as controlling. And I think that the only way to sort of rationalize not doing that is if you see that your enmeshed partner is doing work with his therapist and is, things are moving along. Hopefully that gives you the opportunity to be patient and not feel like you need to always be checking on him. This is a conflict that comes up with partners when their spouse is also a sex addict and has enmeshment issues. There's just a conflict there because you've lost your trust in your partner. You're trying to regain trust. You're seeking safety by, wanting to know where he is, what he's doing. And these sorts of safety-seeking behaviors that are normal for a betrayed partner are sort of in direct conflict with the way an enmeshed man has to go through his own recovery for emancipation and getting away from the family of origin. So that's kind of a balancing act that you definitely would want a specialized therapist working with you to help you navigate that. A lot of times, check-ins can be done, recovery check-ins with your partner. So you have dedicated time to check in on recovery work that's being done, where your time has been allocated, feelings that have come up for you during the week, challenges that you faced. And oftentimes my clients will do a recovery check-in actually at the couples therapy session on a weekly basis. Just having that therapist there to help them navigate that seems to be really helpful and productive until the couple gets to a place where they can do that on their own. So identifying your boundaries and what your bottom line is for yourself. How long are you willing to wait to see your partner make the progress? And are you able to be patient while your partner is doing that work? If your partner is not, then you need to know what your bottom line is to be able to communicate like that. If you aren't seeing this problem and how it's affecting our marriage, your relationship with your mom, and you're not willing to do anything about it, then I'm not willing to stay in the relationship. I certainly wouldn't advise doing that as like a first course of action, but I think exploring that in your own individual therapy and with your support system, what you need, what you're willing to do, and what your bottom lines are. So I think I think I've covered everything that I felt like I needed to get out there before we asked questions.
Okay, great. We can move into some of the questions that we do have. One of them that I'm seeing is, how can I get my spouse or mother enmeshment to be more committed to me and the marriage?
Really, there's nothing that you can do. The short answer is you can't. Because his ambivalence is not about you. It is about his relationship with his mother. So like I mentioned before, if he is doing work, then you can extend some patience and understanding, which I think will, seeing him in a more positive light and him feeling supported and encouraged by you will prevent you from, again, becoming the object of his projected feelings. So you can't. There's nothing that you can do, unfortunately, except for identify what you need and communicate your needs with him. And if he is willing to get the help, then being patient and understanding is going to be the best possible way to handle that.
Okay. I have a good question from the chat where you were discussing how enmeshed men have no identified purpose for their own life. How do you as a spouse encourage them without parenting them?
So I think first of all, you really have to look at like, how is that affecting you or your marriage relationship? And in turn, then what needs are being met or not being met of yours that are directly related to that. So, the healthiest approach always is to deal with confronting what your own needs are, not what's wrong with your partner, unless something that they're doing is impacting you. So, maybe you have a situation where your partner, because he maybe is unmotivated or is lacking in purpose, is underperforming or has financial related issues that are impacting you. And that's when I think you would have to confront, what the impact is on your relationship and on you. And really it's up to him or her to seek out those answers for themselves in their own individual process. So you're just confronting the impact that it's having on you or the impact it's having on your relationship and how you feel about that.
Okay. And then another question is, how do I handle the relationship with his mom and the family of origin? And specifically, I do see somebody mentioning previously how you spoke about not demonizing the mom or the enmeshed parent. How do they deal with the family of origin demonizing them? And how is their relationship, how to manage the relationship with that family of origin or enmeshed parent?
Sure. So that can be tricky. And I can tell you from my own experience that it's not always a situation where the let's just use the mother-in-law as the example, where the mother-in-law, it's not as a case where she may perceive you as the other woman, but she may not be hateful toward you because she wants to maintain this relationship with her son. And so I can just speak from my own personal experience that my husband, when he was dealing with these issues and his mother was feeling him pull away, she was trying to like manipulate me as a way of getting closeness back with her son. And so what I can recommend is like doing, just keeping a healthy distance and knowing what your boundaries are. So for example, one situation, the mother-in-law was complaining about the husband and trying to get me on board with her, like in this triangle with her son. And I just had to set a boundary and say, I'm not willing to talk to you about him. If you have those issues, then I think you need to address those directly with him. So, and then the flip side of that, when the mother is hateful towards you, that's when you have to really have an expectation that your enmeshed partner is going to step in and say, like, you're not going to treat my wife that way or my husband that way. And if they're not willing to do that, then that's an issue that you need to address within your primary relationship in your marriage, either through counseling or if he's not willing to do that, then you need to be looking again at what your bottom lines are, and whether or not you're willing to stay in that relationship. So I'm not sure if I answered if
That's great. I think a couple of questions that I'm getting to is where do you start with the boundaries? As the enmeshed person and as the partner, how do you start with those boundaries without kind of scaring and startling everyone in that process?
The boundaries with the in-laws or with
Yes.
each other? Well, I think that it is the enmeshed partner's responsibility to communicate what the boundaries are, not the partner or the enmeshed adult. And, I think that's something that person can work on with their therapist. And it may, the boundaries may be like, Mom, I'm not going to call you every day. I'm going to call you once a week. And this is how much time I have to spend talking, and these topics are off limits. I'm not willing to talk about XYZ. What I am willing to talk about is this. It could be that a lot of people deal with this over the holidays with my clients, of having to go to their in-laws' house for the holidays. And what they have to do is figure out what their boundaries are before they go. The primary coupleship has to determine how long are we going to stay. If certain situations arise, how are we going to handle that? Maybe having a signal, hand signal or something that they, can connect with each other of like, hey, we need a private moment, or we need to get out of here, and just have that plan unified going into that situation. Do you think that answered the question, Alex?
Yeah. And then I have another question of how should I handle it if he lets his mom interfere with our dedicated time together?
Sure. So there's a couple of options there. You can certainly do nothing and wait and bring it up in a couple session when you're not, highly emotionally reactive about it. And then the other option is to remind him of your boundaries, that when you have dedicated time together, if you're out on a date or something and your expectation or your boundary has already been communicated, that like you don't want him taking calls from his mother or initiating calls, and that happens, then you can remind him of your boundary and say, I'm ending this date. I'm going to go home, take me home, or I'll get a ride home. But that's just the consequence of having my boundary violated, that to take care of myself, I'm going to go home and do what I need to do for me. So either one of those options, I think, is appropriate.
Great. And also I have another question of, is there a timeline, a general timeline for enmeshment recovery, or does it differ for each person in each experience?
I mean, that's going to depend. Every situation is unique, and it also would be impacted by whether or not there's sex addiction involved, which I would expect would take even longer than that not being involved. I don't, maybe Amanda could answer that question better because she works with couples, but most of my clients that are dealing with this are in sex addiction recovery, and it's a 3 to 5 year minimum process. And that's if both people are in individual counseling and they're doing couples counseling, and they're likely in 12-step recovery and accessing all the resources available to them. It's unfortunate that it is such a long process, but we are human beings and we don't change overnight. And we spent a lifetime getting to be the way that we are today, and you can't undo that very quickly, but it is possible. And that's, that's what motivates me to do this work, is because I do see that happening. And I have a lot of hope for my clients.
And just to piggyback on that, is there a different treatment for sex addiction and enmeshment together versus just somebody who's enmeshed?
Well, if someone is in recovery for sex addiction, they're going to have that piece of it on top of the enmeshment piece. So it's not that they would be doing anything different than somebody who is enmeshed and is not a sex addict. They would just be dealing with having to treat their addiction at the same time as dealing with the enmeshment.
Okay, good. Let me just see what other questions we have. Should I pressure the enmeshed man to face enmeshment issues or insist that he go to therapy?
The short answer to that is no. If you pressure and confront him, he will likely be defensive and identify you as acting like his mother. So the best thing to do is to acknowledge your differences of opinion about his relationship with his mother. And then communicating how you see that it's affecting your relationship. That your relationship is important and that you love him and you want him in your life. You want this relationship to continue. So maybe you need to seek out some help from like an unbiased third party. That would be sort of a gentle approach to saying, hey, let's get some help here. We've got some differences, but this relationship is important. So let's get somebody, who is not involved, and then bring in a couples counselor who is trained in this work.
Good. And then we did have one more question. If the enmeshed mother is deceased, how do they handle that going forward?
Sure. So even if the mother is deceased, the enmeshed partner is still going to be have limitations on their ability to connect intimately. So until he goes through a process of emancipating himself, he's not going to be able to do that, whether the mother is alive or not. And that's the great thing about Ken's workshop, is that he works with the men to help them to individuate and emancipate themselves so that they are available for intimacy and connection and passion in their relationships. So it is a slow process, though, and it requires patience.
And then I do have a couple of people asking, is there a difference with enmeshment with the father versus the mother, or with both parents versus just one parent?
A difference. So are we talking about like a female enmeshed with her father? Is that what you're referring to?
I see both. I see enmeshment with a mother, or a son enmeshed with his father, as well as a daughter.
Okay. I've done work. I think this particularly happens more with women, where they are involved with both parents, maybe often, versus just one, because culturally, it's culturally acceptable, like for women to be caretakers of their family. So women are typically put into these roles, especially if the parents are older, of caretaking the family. And so it could be both parents instead of one, and that interferes with the marriage relationship. I don't see the process being any different when it's two parents versus one parent. It's just you're going to be setting, boundaries with both parents or with the system as a whole, and focusing on individuating and emancipating from the system, not just the person. Because you may have, it can be elaborate system, right? It could be just not just the parent, but proxies of the parent. So you might have like a sibling who, is saying, you're a disappointing mom and trying to make you feel guilty. So it's really not that much different, I think, in the way that we handle it. It's really about setting boundaries and freeing yourself from the the obligation that you feel like you feel guilted to take care of these people in a way that's not appropriate and prioritizes over your family procreation with your spouse. So
And I am seeing some people ask about getting some insight on that process of emancipation and individuation. What does that look like, just generally?
Well, so in Ken's workshop with the men, he takes them through a process that really creates like an internal shift of them, understanding and identifying and connecting with their true self. He probably has some explanation on the overcomingenmeshment.com website that gives a little bit of insight about that. And also just reading the When He's Married to Mom book, he talks some in there about it. What I can't hear you, Alex, your mic is off, but I just want to add something to that. So, in general stages of development, like when you're, growing up, children start to individuate from their parents when they're about 18 months old, when that process starts. And it continues on until they reach adulthood and leave the home. And it's a gradual process. So what happens with families that are enmeshed, that gets stunted. That process gets stunted. So as adults, we have to go back and, reparent ourselves and help ourselves to individuate and do what our parents didn't do for us. So part of the process is growing yourself up. And, a lot of enmeshed are kind of stuck in a state of adolescence, and they need to grow up and free themselves from the family and individuate and be their own person. So.
Okay, and let's see here. So what if the enmeshed partner refuses to go to therapy? Is there any other steps they can take, or is that really waiting on that process for them to accept it?
If they won't go, is that what you said?
Yes.
You kind of broke up. Sure. So if your partner won't go to therapy and you're not ready to, lay out a bottom line that you're leaving the relationship, which I'm not suggesting that you should. I don't think that that's a good first course of action. But what you can do is go to therapy yourself. I have a lot of female clients who come in and their husband is not getting help yet with their addiction or their enmeshment. And they are coming here to take care of themselves and figure out how to meet their own needs and figure out what is that like to set a boundary, or what is a healthy boundary, or where can I get these needs met, or at least some of them, outside of my primary relationship, you know, before I can really evaluate whether or not I want to leave this relationship. So I think that the first step is to work with a therapist to figure out your own needs and wants, and, you know, any issues that you might be bringing into the relationship yourself, and you know, work on those things. And a lot of times what happens is, you know, when one person starts to change, the relationship can't stay the same. And so, you know, when a partner starts focusing more on themselves and is taking the focus off of the enmeshed partner, the enmeshed partner is going to notice that, you know, and it might be that they are more willing to join into therapy at some point. And I've seen that happen a lot. So taking the focus off of the, you know, person that is perceived as the problem in the relationship and taking care of yourself, I think is the number one priority.
Do you think there's any characteristics of women who do fall in love with enmeshed men, or is it something that you feel like would come up later in a relationship?
Well, I have a couple of thoughts on that. I think, you know, initially, women may be attracted to men who are family oriented, who do respect and love their parents, and they don't see that, you know, going into it, that it is an enmeshed relationship. They just see it as a close relationship. And then, you know, I guess over time and maybe after marriage or whatever, you figure out that no, it is too close. I do think that in my experience is that, you know, whether you're male or female, we're attracted to people for reasons that there's something familiar about them. So from our past experiences, whatever this person that we're attracted to, whatever qualities they have, characteristics that they have, some of those are going to be qualities that are familiar to us. So we're not attracted to things that are unfamiliar to us as a species. So, you know, there's an opportunity to kind of explore there if you're a partner, like what it is that you were attracted to about this person that maybe, you know, has been familiar to you. And, you know, I can just tell you from my own experience, you know, I had a very loving father who was always there, and there was no doubt in my mind that he loved me, but he was emotionally unavailable. So that was familiar to me. And so, you know, when I got married the first time, I was attracted to somebody who wasn't emotionally available because that's what was familiar to me. And it wasn't something that was like in my conscious mind, right? But it did happen. And so I see a lot of that in my practice as well.
Interesting. And then it can get compounded by that relationship again, and it just becomes that cycle. So I can see that happening.
But you know, that's when that's when you go into therapy, you know, for yourself. So, you know, I left that relationship and went into therapy in my own process for about 15 years before I got remarried. And the person that I was attracted to was not like that. But I had to get, you know, to know myself better and understand, you know, why I was attracted in that first relationship. And as I grew and knew myself better as a person, then I was attracted to healthy people. But it takes, you know, a lot of work and time and willingness to commit to that. It's rewarding. It was rewarding for me. So.
Right. And do you think that in your experience, do you have any insight on enmeshment differing in different cultures or being more accepted in different cultures, or is that something that you've seen?
Oh, for sure. 100%. And, we have to be really cognizant of that as therapists when clients come in and they're more from a more collectivist type culture where they may not be comfortable with these concepts of individuation or emancipation. And so we have to sort of, help them figure out how they can balance that with meeting their own needs and taking care of those. And it can be tricky. And obviously every one of those situations that I've worked with has been completely different. And I've worked with people from, several different backgrounds. So it's really a process of working together with the client and kind of exploring what's tolerable for them, that they can feel comfortable with, and helps them get what they need. So it's possible,
Yeah, and
but
I'm seeing a
it
lot of
just
questions
doesn't.
about. Oh, I'm sorry.
Oh, I was just
I
going to
was just
say,
seeing a lot of
it's
questions about bottom lines and what boundaries look like for each person. But from your experience and even just from my experience, I think that the boundaries can differ completely for each person or each family, and individuation can mean something completely different for one person than for another. And just how do they find that bottom line, and how do they set those boundaries in place?
As a partner, or is that what you're talking about?
I see both in these questions. I do see some from partners, but just differing between, what do they know the bottom line is for themselves? As a partner, I see that specific question in here.
Sure. Well, for one thing, you have to know yourself and what you're willing to accept and tolerate and what you're not, in order for you to be happy and fulfilled. And so that's really guiding sort of any kind of boundary that you may have, which looks different for other people, for different people, right? In response to the individuation piece, I mean, all people go through a process of individuation, typically, eventually people grow up, and it might not happen until they're really a lot older than you would expect, but it does happen. Like, we do get to know ourselves and who we are as a separate being from our parent. And that is different than the emancipation, which is like, the cutting loose from your parent, which is honestly like the parent's job is to equip their child such that they can do that and to feel joy about their child doing that, not feel like trying to draw them in or have strings attached to them. So those are two different processes. But in the therapeutic process, when you're working on these addiction issues or enmeshment issues, a lot of it is doing work to answer that question: who am I? Who am I without drugs and alcohol? Who am I without my sex addiction? Who am I without my gaming? Who am I without being addicted to this person? It's just about finding out who you are, right? And finding out how to get your needs met in a healthy, functional way versus through other behaviors or consumptions that just merely alter or numb how you feel so that you don't have to experience the pain that you're not addressing.
And on the contrary, I do see, is there do you have any experience with the sexual anorexia or lack of intimacy that people can have with enmeshment?
Sure, that's tricky, but it's just the flip, it's just the other side really of the same coin, is that they don't feel the freedom to be themselves, they don't feel the freedom to express themselves sexually and intimately, emotionally or sexually intimate. So what was the question again?
Just if you had experience with the sexual anorexia and kind of what that means, and if the process of recovering from that is similar to the sex addiction or other addictions that can happen with enmeshment.
Sure. It's similar in the way that I work with people, in that is just as much a coping mechanism as an addiction is a coping mechanism. And, how going backwards into how did we end up here in the first place, and healing the old wounds, and identifying what we need, what we want, and how we can get that, and what support we need to do that. So, when a client comes into me, I see it, it's different, but I see all of these problems as symptoms of a bigger problem when I address them. So my approach would be similar. The supports that people need may be different in their treatment plan, but generally we're working with the trauma that got you to where you are today, that you have this issue that's manifesting the way it is.
Right. And that's why we do have that Find a Therapist page on the website. All of those therapists listed have taken a course in treating adults enmeshed with a parent. And if you are looking for a therapist who's also experienced with any addiction, that is listed on there as well. I know quite a few of them are also CSATs or CMATs, certified multiple addiction therapists. So that is a resource that we do have on the website. As well as the workshops. As I said earlier, if you weren't in the webinar when we started, Erin is our women's workshop facilitator. So we do have a workshop that specifically deals with enmeshment in women. We also have the Mother Enmeshment workshop. And then we are also looking into scheduling a couples workshop for after the initial level 1 workshop that works on building that relationship and creating those boundaries together, and kind of addressing how the enmeshment has affected the relationship individually. So you can find some of that information on the website as well.
Do you have the date for the next women's enmeshment workshop? It's in February, yes, right?
We have the women's workshop is February 11th through the 13th. And then we most likely will have a few more throughout the year. And then we do have the men's workshop. Our next one is April 7th through 10th. And we do have some availability in that workshop as well. So if you do have any questions on that, I believe I put my email up in the top of the chat. And you can email me directly to get started on that process. Or if you're looking for any other resources, you can also shoot me an email and I will try my best to direct you in the direction that you're looking for. And then we will be having our next, let me double check on the date on that. Our next webinar is February 9th. And that one will be with Dr. Adams, and that will be discussing protecting your relationship or love with enmeshment. So I will put my email one more time in the chat. I do see that someone is asking for that. And yeah, we will be having our next webinar February 9th with Dr. Adams. Be sure to check our blog. This will be our blog, as well as we do have a new podcast that Dr. Adams just recorded this week. So that should be out within the next couple weeks. And I will keep everyone posted on that as well. Erin, I don't know if you have any closing remarks that you can say.
Yeah, so I think that we are in the process of developing a workshop for partners. And I don't know when that's going to get rolled out, but that is something to look forward to. And I'm kind of excited about that. So that may be another resource out there. And also to mention that when people do the enmeshment workshops, we're also working on creating some aftercare support groups, so that if you've done a workshop, like anybody that's done the workshop once a month can like jump on a call with me if you're a woman, you know, or John if you're a man. So we're working on that too, and hopefully we can get that out soon.
Yes,
You know,
we
rather
actually
than
do
later.
have a men's one set up currently. We
We
don't
do.
have the women's one yet, but after you've taken the level 1 workshop, you can do Coffee with Ken, which we limit to only people who have attended the workshops, and we do try to keep it small, I think under 20, to share any successes or struggles that you're going through after the workshop. So we are trying to keep these resources going, and keep it open for people to have a continuing resource, and continuing care. So we will have those getting started for that couples or the partner workshop that we're working on. It will be a different setup. It will be, Dr. Adams is thinking doing it a couple hours on a Saturday spread out. So one Saturday you'll do the workshop, and then the next Saturday will be a couple hours. So it's a little different than just the weekend long workshops that we're doing. So we are working on getting that. If you wanted to be put on a wait list, you can also email me and we will put you on a direct wait list so that you have that first notification once we do get the date set for that.
Yeah, great.
All
Yeah,
right.
well, thank
Thanks
you.
for joining us, everyone. Thanks for being here, Erin.
Yeah, thank you for having me.
All right. Well, I'm going to end this now. Let me just stop this. And like I said, this will be on our blog, so be sure to check that out.
Thank you.